Hello, my name is Ken-ichi Hirata from Kobe University. I am the president of JCS from 2020, succeeding the past president, Dr. Issei Komuro. Now he is the president of APSC. It's my great pleasure to have an opportunity to introduce Japan Circulation Society in APSC. The title of my talk is Current Issues and Future Prospects of Cardiology in Japan. Japanese Circulation Society has a long history of over 80 years. The first general meeting was held in 1936. The activity of JCS are to hold scientific meetings and to give scientific lectures, to issue official journals, such as Circulation Journal and other publications, to conduct studies and scientific research activities, to contact and cooperate with associations for related societies in Japan and abroad, and to encourage and support study and research. JCS has 5 groups to perform our mission and activities: membership, research, Congress, education, and advocacy. JCS is responsible not only for research and medical care in cardiovascular disease, but also for many social roles, such as improving the healthcare system, disseminating guidelines, and developing human resource across multiple occupations. The number of regular members of the JCS has been increasing. The number of the JCS is more than 30,000, including associate members in 2021. The JCS has more than 15,000 cardiovascular specialists and is recognized as one of the major medical associations in Japan in terms of the importance of cardiovascular disease. This graph indicates the leading cause of death in the world. The first cause of death is ischemic heart disease, and second is stroke. We can say 26% of deaths is derived from cardiovascular disease. This situation is same in Japan. Cardiovascular disease account for 23% of the total number of deaths in Japan. In addition, CVD causes financial difficulties in Japan. The most medical expenses, around 20% from the total $4,300 billion, are used for CVD. This slide shows the average life expectancy and healthy life expectancy for both men and women. Both of them increased from 2010 to 2016. In Japan. However, the healthy period, which was defined as differences between healthy life expectancy and average life expectancy, was large, almost 8.8 years for men and almost 12.4 years for women. In 2016, the patients with heart failure are rapidly increasing in Japan, so-called pandemic of heart failure. There is 1.2 million heart failure patients in Japan. This slide shows the mortality rate in heart failure and cancer. As you know, the prognosis of cancer is not so good. However, the prognosis of cancer is improving because new diagnoses and drugs for cancer are developed. The clinical study shows the prognosis of heart failure is poor compared with cancer. Therefore, prevention of heart failure is important for extending healthy life expectancy. To extend healthy life expectancy, JCS and related societies had published the 5-year plan for overcoming stroke and cardiovascular disease in cooperation with Japan Stroke Society in 2016. The 5-year plan set its ultimate goal in extending healthy life expectancy under the slogan of CVD. Slogan of Stop CVD. Stroke, heart failure, vascular disease are listed as 3 major diseases. It also contains 5 major strategies: human resource development, improvement in the healthcare system, disease prevention and education people, development of patient registry and database, strengthening basic and clinical research. After JCS made 5-year plan for overcoming stroke and cardiovascular disease in 2016, the Cerebrovascular and Cardiovascular Disease Control Act national law was established in 2018. The government made the basic plan for overcoming stroke and cardiovascular disease in 2019. Many research groups have started up to fulfill measures, and the 5-year plan is developing and expanding on the prefectural basis in Japan. This slide shows the national plan for promotion of measures against cerebrovascular and cardiovascular disease, Japanese national plan published in 2019. 2 main goals of the Japanese national plan are to extend healthy life expectancy by 3 years by 2040 compared with 2016, and to decrease age-adjusted mortality of cerebrovascular and cardiovascular disease. Japanese national plan includes 3 measures. First, spreading awareness of prevention measures and accurate information on cerebrovascular and cardiovascular disease. Second, enhancing service provision system related to health, medical care, and welfare services. And third, promoting research on cerebrovascular and cardiovascular disease. Prevention is important to reduce CVD and extend healthy life expectancy. Advocacy group promotes the activities for prevention of heart failure by characters and ribbon using SNS. We used Ninja Shinzo. Shinzo means heart in Japanese. A famous character was helping us to enlighten to importance of heart. Next, I will talk about the activity of research group. JCS had 2 official journals, Circulation Journal and Circulation Reports. The Circulation Journal was established in 1935 which is an international peer-reviewed journal in English, and published monthly. The Circulation Journal aims to publish high-quality materials, both clinical and experimental, on all aspects of cardiovascular medicine and surgery. Impact factor was almost 3 in 2020. Circulation reports. Another journal is Circulation Reports. Circulation Reports is an official open access scientific journal of JCS, which was established in 2019 and indexed PubMed. Circulation Reports considers more manuscript types and research areas than Circulation Journal, such as protocol papers and healthcare policy papers. We are waiting for submission to the Circulation Journal and Circulation Reports from all members of APSC and appreciate your contribution. This slide shows the activities of research group and education group. In addition to official journal, JCS has registry system, so-called JROAD. And JCS published more than 60 guidelines. And JCS provide grants for clinical and basic researchers and medical staffs. Education group of JCS performs human resource development, such as certified member system, certified heart failure educator of Japan, certification for ACLS, BLS, the education for young cardiologists, and education for medical team. Another important activity of JCS is the scientific meetings. JCS aims to enhance the partnership with Asian countries and promote further globalization. JCS Congresses participants are more than 15,000, including from 30 countries. JCS have about 4,000 abstracts and 2,500 oral presentations in every annual scientific meeting. The annual scientific meeting of JCS has English sessions more than 50% and provides some grants and awards for cardiologists and researchers in Japan, as well as foreign countries. JCS had rejoined the APSC and was supposed to host the joint meeting of the 84th Annual Scientific Meeting of the JCS 2020 and the APSC 2020 in Kyoto. Unfortunately, due to the spread of the COVID-19 infection, the joint meeting with APSC has been postponed. In this year, the JCS 2022 and APSC 2022 was planned to be held at Kobe. However, we have decided to hold the meeting entirely online because of rapid spread of COVID-19 variant. We are preparing various programs and events at this special online meeting. The success of JCS and APSC 2022 depends on your support. I look forward to your participation in the meeting and sharing new information of cardiovascular medicine. We hope that all these participating in APSC from other nations would experience the significance of cardiovascular treatment and research in Japan by attending the scientific meeting of JCS. I think interaction and collaboration between APSC and JCS is very important to develop cardiology in Asian Pacific countries. Therefore, comments and opinions from APSC are greatly appreciated. Thank you very much for your attention and cooperation.